Hello, good afternoon, everybody. I hope your Saturday is going well. This is Pastor Wale Afelumo, and welcome to Safe Space with Wale Afelumo. We have an amazing episode for you today. And before I tell you what we'll be talking about, remember to subscribe to this YouTube channel, and you can also share this with your friends so that they can be a part of this. Today we are going to have a very important discussion. Also remember that this should have been live ordinarily, and I explained why we are not doing it live because of internet issues. However, we'd like your questions to come in so that the experts in the house today will be able to answer your questions in the chat box. So you can type in your questions at any time and we'll be able to answer your questions. Like I said, I have a medical doctor here with me today, and we'll be talking about what I've titled your health and your lifestyle, diabetes alert. Talking about diabetes. I believe it's something that is very important, but so much is not being said about it. From my little readings, I realized that it's responsible for a lot of mortality and morbidity, especially in developing countries and sometimes even in developed countries. But I guess because it's not the very obvious and, well, let me not say what I want to say, issues, much attention is not focused on it. So today, I have with me somebody who is a consultant, physician, cardiologist. Is the group medical director, the Limi Group of Hospitals. At Limi Group of Hospitals, I'd like you to welcome with me Dr. Iseko Iseko.
Thank you, sir, for having me.
Yeah, it's good to have you.
Yes,
It's good to have you on our program.
Great.
Thank you very much. Thanks for coming today. So you've heard what our discussion is today, and I've been privileged to have you be my doctor for some years now, and I'm telling you, this is an amazing personality, a fine brain, well-trained, and just on top of his game. You need to follow him on social media, and I'll talk to you about some of his, he will tell us about his social media handles later. He has some witty quotes every now and then. I just read one today about not spiritualizing. If you've never used your faith to just wash your hands, sanitize your hands, and wear your mask. And I think that's very good. So, like today, we're talking about diabetes, you know, and this topic came to my mind. It's just been recurring in my mind to talk about it. Honestly, I really don't even know why. But I'm hoping as a doctor, maybe you'll help us today why it's been so strong on my chest to talk about this. Can you tell us what diabetes is? Considering that we are lay people, how can you help break that down for us?
So, diabetes essentially is an energy disorder.
Did you say energy disorder?
Energy,
Wow.
yes. So it's a disorder of energy and carbohydrates. It's a food disorder. Essentially, it means that when somebody eats, their body is unable to take the energy out of the food into where energy is needed. And so the energy in form of sugar tends to float around and gets deposited in different parts of the body, causing a lot of damage. So essentially, it is the body's inability to properly handle carbohydrates and break it down into energy. And so people become weak, they get a lot of complications, heart disease, strokes.
I guess we'll talk about some of those complications later. So it's an energy disorder. That's the first time I'm hearing that. It's sugar that first comes to my mind. But at some point, you connected the energy with sugar.
Yes.
You know, basically. So it's the inability of the body to absorb.
The body to take sugar out.
Okay.
To take the energy out of the food that you're eating.
Okay. Wow.
So essentially, when we eat, it's broken down into smaller molecules.
Yeah.
Those molecules, with the aid of a hormone called insulin.
Insulin, yeah.
Insulin helps to take the energy and push it into the cell. Take the sugar and put it into the cell. Okay. So sugar is like the building block, not sugar as in sugar that we take, but sugar is like the building block of energy, and insulin helps to take it into the cell. So sometimes the cell is either not responsive to insulin, or there is no insulin in the body.
And from my little finding, the insulin is it comes from the pancreas. That's what secretes.
So the pancreas is a little tiny organ, looks like a leaf. It's somewhere inside our bellies,
Yeah.
at the back part of the bellies, under the stomach.
Yeah.
It just releases just a small amount of insulin per time, and just when we eat, it gets triggered.
Okay.
And then it also releases some continuously just to take energy, push it into the cells, and then we are able to do everything we do.
Wow, wow. Thanks, doctor. So now, are there types of diabetes? In what variations does it come?
So essentially, phenotypically, sorry.
Yeah, well, go ahead. I will still task you on that to break it down for us.
Essentially, the way it is expressed to the individual is essentially expressed almost the same way. However, from a standpoint of how what happens, the types could vary. We could say type 1, type 2, but a lot of the world of science is trying to move away from those typologies and to say that, look, this is an energy disorder, in which case there can be absolute insulin deficiency, that is, the insulin is not available, or there's relative insulin deficiency. It means the insulin is available, but it's unable to work the way it's supposed to work, either because the insulin is deficient itself, or the body cells are unable to receive it, or the person has other hormones that are fighting the insulin, and so the insulin cannot get into the cell. So, but
like an autoimmune.
Like autoimmune,
the body fighting.
Sometimes even if somebody is extremely fat, the fat cells themselves release some hormones that also stop the insulin from working as it should. So it kind of creates what is called an insulin resistance syndrome. So the body is actively resisting insulin. By doing that, the body is unable to take in all that energy that you are eating, and it kind of gets stored in the wrong places, floats around, and causes issues.
So we shouldn't get stuck in the types. This type, there's a challenge, and that challenge needs to be addressed, whatever type it is.
Exactly.
Okay, fantastic. Now, doctor, before we proceed, why do you think it is important for us to talk about this? Why do you think our viewers, the world, or whoever is listening, should hear about diabetes? How much of an issue is it?
So diabetes is quite a serious issue, very, very serious. Unfortunately, it's underreported, undertreated a lot of times, especially in this part of the world. WHO estimates that in sub-Saharan Africa, diabetes will be at about 1 in 6 people. Whereas in Nigeria, if you count 6 people, 1 person will have diabetes by 2023, 2025. But currently, we don't have so much data in the country, but we know it's quite a lot. People that all of a sudden you've heard that they got remote control from the village. All of them have a lot of things that have to do with diabetes, hypertension, heart disease. Remote
control being what we Africans will say, they pressed a button in the village and the person just slumped in town. So it's always not remote control.
It's not always. Okay. So we've had a lot of people that come with a heart attack, never knew they were diabetic. About a month ago, we had somebody come with a heart attack, did not know he was diabetic 41. And the sugar was extremely high and quite difficult to control. So it is quite an underreported and very catastrophic, and it's one of the most catastrophic diseases. It is costly to manage, and it can be easily prevented, and there's a lot of things that you and I can do to help out in the long term.
Wow, that's amazing. Help me correct this mindset. I don't know where I picked it from, but I always thought that diabetes is only for obese. So when you see somebody that is fat, you just say, When they say diabetes and you are just maybe average weight 80 kg, 75 to 85, you think you are fine. Is that, can you help me? Is that correct?
So
is it always correct? Maybe I should say that.
Okay, so it's not always correct. However, it's also bettered in some level of truth. Because a lot of people that have excess adipose tissue also
excess what?
Excess fat.
Okay.
Excess fat. Also,
okay, guys, I'm going to school today. By the time I'm done with doctor, I'll be an MD myself.
I'm so sorry. A lot of people that have excess fat, like I said before, also have insulin resistance. So the tendency for more of what we used to call, what is called type 2 diabetes, it tends to happen more in people that are obese, that have excessive fat tissue. However, that does not streamline anything. People that are slim, I've seen people of all sizes, of all ages. Children, even from 2-3 years old, can have diabetes, can need insulin, and things. Typically, those that happen younger, slimmer, are typically the ones that need a lot of insulin, and those that are bigger are typically those that have some level of insulin resistance or the other. And so it generally cuts across, and nobody should say, I am slim, therefore I can't have diabetes, or I am fat, therefore I must have diabetes. It doesn't necessarily follow. There are a lot of factors that are at play.
Okay, thank you, doctor. I go to the hospital every now and then. I hear about cholesterol and all of that. Now, does it play any role in diabetes? Is there a connection between one's cholesterol, high cholesterol that is, and diabetes?
So diabetes and cholesterol are two important components of cardiovascular disease. It's a broad spectrum of diseases that ranges from stroke.
Cardiovascular will mean
heart
with the heart,
and blood vessels.
Okay.
So how I refer to the cardiovascular system is that this is a pump and these are pipes.
Okay.
So you have a pump and it's pumping round pipes. Diabetes tends to block the blood vessels, make them stiffer.
Diabetes or cholesterol?
Diabetes and also cholesterol.
Wow.
So both of them kind of work synergistically to worsen the heart, to worsen the brain, kidney function. So essentially when somebody has diabetes, we tend to treat cholesterol at much lower values. Cholesterol on its own is not particularly a bad substance. It's a building block for cells. But what happens is that over time with diet, with sedentary lifestyle, with age, it tends to increase beyond levels that cause problems. So when we watch people over time, and how we have arrived at this as scientists is that when we watch people over time, we realize that people that have these problems, heart attack, strokes, kidney failure, tend to have cholesterols above a certain level. Now, in people that have diabetes, they have it at a much, much lower level. So it means that someone that has diabetes will definitely need to have some level of cholesterol treatment at much, much lower levels in order to prevent all these
attendant cases.
So that's how they are really related in a way.
Wow. So somebody is listening now, and many people don't like to go to hospitals. When they hear hospital, you're going to hospital, like, you know, it's like a death sentence for some people, and what you don't know won't kill you. That's the model for some people. Now, how will people know if they are contending with diabetes? Are there symptoms, you know, that tell people, early symptoms or even symptoms that accompany diabetes, so that people can know?
So a lot of the cases of diabetes are asymptomatic, meaning people are not feeling anything at all. They just, if they check their blood sugar, they find out it's high. And so that accounts for a very big portion of people in Nigeria. People that are having diabetes and not feeling anything. They say, I've never been to the hospital and I'm fine. So one of the ways is just to check. A small pinprick and boom, we know your blood sugar. And less than 2 minutes, the blood sugar is out and we know what it is. So it's quite important to check. But having said that, there are a number of symptoms that you can look out for.
Before you go, you earlier told me about a patient, a pastor or so, that came that was asymptomatic. And
so I said about some months ago, I saw a pastor just feeling weak and tired and listless, treated malaria and so many things, and came in. His blood sugar was unrecordably high. I mean, we had to give almost 3-4 liters of fluids, lots of insulin before we could even get to a recordably high region. So it was really above the value that the machines could read. That is how high. And so
he didn't have any, major symptoms.
He did not have any major symptoms. Yes, he noticed that he had some urinary problem, but he did not attribute
nothing that was concerning.
Nothing that was concerning. So if he had not come to the hospital, at that point in time, it starts drawing fluid into the brain, you start getting drowsy, and the person loses consciousness, and then, it becomes a different story.
And that's what we call remote control sometimes, right?
Well, in Africa, people see that and believe that witches, wizards, your mother-in-law did something to you.
Because such a person could have just fallen down.
Exactly.
And people will say, he wasn't sick or he was fine. We even came to my house yesterday. Somebody must have done this.
So that is really a major concern. So it's quite important that you check. Just check. I'm not, of course, I'm a doctor, so maybe I'm not the best person to say that, but I'm not sure saying that you have never been to the hospital in 5 years, in 10 years is a virtue. I believe that even in the scriptures, Jesus said, go to the priest. And at that point in time, the priest served as
like
the person that made the diagnosis and said, okay, you have this or you have that.
Yeah.
So I think that going to the doctor is something, even if nothing, to say, show the devil that I'm well.
Fine.
So
fantastic.
you go get yourself checked.
Fantastic.
Now, having said that,
about the symptoms,
some people now have symptoms. And one of the most symptoms we have are what we call polyuria, polydipsia, and weight loss. This is called the classic triad of symptoms of diabetes. Polyuria simply means, poly means plenty, okay? And urea means urine.
Yeah.
Polydipsia means poly, excessive test. So the person is always looking for bottles of water, always thirsty, drinking lots of water, going to urinate large volumes repeatedly over and over again at night, in the morning. And we typically will ask simple questions. How many times do you urinate at night? So by the time we notice there's a significant difference, then we say, oh, something is going on here. Okay? Then, of course, weight loss. Remember we said that diabetes is an energy problem?
Yeah.
And that when you eat, the body is able to convert it. So all that food comes in, but the body is able to convert it, so the person keeps on losing weight.
Wow.
And so the 18th century description of diabetes was suffering in the midst of plenty.
Involuntary weight loss.
Involuntary weight, despite eating.
Wow.
You are hungry, you are eating, but you are still feeling weak and you are losing weight.
Wow.
It is like some cultures will say, you are eating and somebody is putting straw and sucking it from another place.
Wow.
I'm sure there's a Yoruba saying to it.
Yeah.
You know, somebody is putting straw from another place, it's not getting to you, you are still weak, you are still hungry, and you are eating more. So in fact, the people actually also become consistently hungry as well. So they are hungry, they are thirsty, they are drinking lots of water, and yet they are losing weight and losing strength.
Wow.
So that's the classical description. However, there's also a third group of people that come with symptoms. This is the unfortunate group. These are the people that come with symptoms of complications. They did not feel anything at all. They just came with a gangrenous toe, which need to be cut off. You know, they just come with a heart attack, and it's at that point in time we realize you have diabetes, or they come with a stroke, or they come with difficulty seeing, or in men, erectile problems, or in women, they have a lot of what they call toilet infection, so urinary infection. They treat it again and again and again. And then some people just multiple boils, because really what's happening, there's so much sugar in the body.
The bacteria
it's like it's a party for bacteria.
Wow.
You treat them, but there's just sugar drawing them back, so they keep on growing and causing issues. So those are some of the things that we should worry about when we think about diabetes.
Wow. Maybe just on a lighter note, growing up, I used to hear the adults say, I guess now that I'm older, that perhaps it was diabetes they were trying to diagnose, that person should pee on the floor, and if ants gather, you can tell that that there is high sugar in your system, a lot of sugar in your system. Is that a good way to test?
No, unfortunately not. Unfortunately not. However, it is not bettered in ignorance. It is actually bettered in science. And so when the blood sugar is quite high, it now spills over into the urine. It crosses what we call the renal threshold, and it spills over into the urine. And so the person starts urinating, and there's a lot of sugar in the urine. And so even older doctors still, and older people still try and use urine to make diagnosis of diabetes. However, things have changed. Why? Because we know that some people's kidneys somehow, even when their blood sugar is high, the sugar does not enter the urine. So they might have a high sugar, but no sugar in their urine. And some people have normal sugar, but sugar in their urine, just because the kidney just allows some more sugar through. So essentially, it's no longer a reliable way of assessing. But it is still one of the things that you can see. I mean, if you're in a village and have nothing to do, in fact, the old school nurses will actually put a finger in there and test.
Gross. So the best thing is go to the hospital.
Yeah, that's the best thing. Go to the hospital, check. I would say check at least. If you're above 40, make it a birthday gift. Get to a hospital, have your certificate, your ECG, have your blood pressure, check your cholesterol, check your blood sugar, check your body mass index. Know your numbers. It's always somehow you see somebody with something and you say, do you have any past record? And the person says, I have never checked. and he's 50 something. He has never ever checked anything, and now we cannot tell how long this thing has been, how intensive we should. Well, we'll not start treating anyways, and so let's start like that. But really, something that somebody should. Now, if you are younger, you still need to check, especially if you have the symptoms, or if there's a family history of any of these in the family. It's quite important to check. But nonetheless, every 5 years, it's still not a bad idea to check your blood sugar. It's probably cheaper than the internet subscription.
So what happens if it's left untreated?
So, wow, that's really the bad part about it. It's really sad. Diabetes is the leading cause of kidney transplants worldwide.
Wow, I never knew that.
Yeah, it is. And so we have this myth in Nigeria where people will say, it's because I started taking drug. That is why I had kidney problem. The truth about it is that you started taking drug either too late or you're not taking enough drugs. So worldwide, diabetes is really the cause. In Nigeria, there is a little bit tussle between diabetes and other things. So we have other causes of kidney failure, like drinking herbal medications. It's a very high cost in Nigeria, unfortunately.
Drinking
herbal concoctions.
For real?
Yeah, because a lot of things are put inside, ethylene glycol, the thing inside fridge, and it just knocks off the kidneys immediately. So unfortunately,
break that down again. Ethylene glycol.
So ethylene glycol is something that's inside the fridge.
The coolant.
The coolant.
Yeah.
So sometimes it's mixed inside some of these herbal concoctions, and it just knocks off the kidneys. Or some things we don't even know what's inside. So in Nigeria, that is quite high. Then infections also is quite high. And then what we call glomerulonephritis, which is the body attacking its own kidney, is also high. So that also competes with diabetes in Nigeria. But worldwide, diabetes is the leading cause of renal failure and transplants.
Wow.
Diabetes is also the leading cause of non-traumatic amputations, meaning when anybody has to lose a limb and it's not because of an accident, it's likely going to be diabetes.
Wow.
So we see somebody with one leg or the other, and some cases we've had to amputate 2 legs.
Why? Because there are sores that are not.
So what happens is that the diabetes, together with cholesterol, tends to make the blood vessels very hardened and close up. And so blood supply to the limb just gets cut off. And essentially what happens is that it dies. So it starts becoming black, smelly.
Wow.
And sometimes they get a wound, they don't even know because nerves also are cut off. They get a wound, they don't know, they get a very big sore, it gets gathered a lot of pus. And the only way to save life, unfortunately, would be to cut it off, especially if it didn't come early. So it's one of the key cardinal things about taking care of diabetes is to check those legs consistently, check blood supply, and if there's a problem, we'll take them into the cath lab and open up.
Is it true about numbness? Can that be some of the, when you start feeling numbness, can that be a symptom, a reason to go for a checkup?
Yeah, so anything that you're feeling that is abnormal to you should be a reason for you to get it checked out. It could be nothing, or it could be something.
Better safe than sorry.
Better safe than sorry.
Wow.
So somebody comes to my office and says, Doc, well, there's nothing wrong with me. It's just that when I change a tire anytime, I feel a small chest pain. I said, wait, what did you say? I said, we have been talking about that since and just stop. So something that may be trivial to you may be a textbook definition of a life-threatening illness.
Wow.
So, like now we've talked about weight loss or get always hungry, always drinking water. It could not have meant anything to you. But if it's new and it's different, you should get it checked out.
You should get it checked out.
So that's
Awesome.
what I would just say about that.
Awesome. I've been with Dr. Iseko Iseko, a consultant cardiologist and physician. We've been talking about diabetes alerts, basically to create awareness on this topic, and it's been an interesting discussion. If you've not done so, please subscribe to the page, share with your friends and family. What I've been doing is I sit with my children and I actually watch these sessions because the awareness is really very important. Also remember, you can ask questions. Just type in your questions there and doctor will be there to answer your questions. I will also be there to answer the little I can. Thank you very much. So hang in there. So doctor, what are the factors that predispose people to diabetes? So is it age, is it genetics, is it diet, or is it a combination of all of these things? From experience and from learning, from reading, whatever, what are the factors that predispose people to diabetes?
So diabetes is one of diseases that is considered a lifestyle disease as well.
Okay.
And so what it means is that there is an interplay between both genetics and environmental factors. So in some cases, we have straightforward monogenic or polygenic, meaning one gene or multiple genes that lead to diabetes. The person has the gene for diabetes, and boom, they get diabetes. But in most other cases of type 2 diabetes, the person has the genes from one or both parents. However, they also engage in environmental factors that aid the expression of the gene.
Environmental factors being sedentary.
The chair.
Sitting
we say sitting is the new smoking. So
wow.
The same kind of cardiovascular disease that could happen from smoking is almost equivalent to that which you get from sitting for longer than 8 hours a day. That includes my job also. So it's the same kind of one that happens while sitting. So it's something that comes to play. No exercise, eating processed foods, adding weight, and by the time all those come together, then it now plays a big role. Now there's also the risk of development of what is called gestational diabetes, which is diabetes in pregnancy, and whereby some women tend to have blood sugar raised up during pregnancy, and after pregnancy it comes back down. About between 6 weeks immediately after the placenta comes out, it comes back down. Such women are also at increased risk of developing diabetes later on in life. Sometimes...
Will it affect their children, the child they are pregnant with?
Yes, so a lot of times gestational diabetes, first of all, the babies come out very big. So every time a child is born that is greater than 4 kg, we wonder whether the woman had diabetes, and subsequent pregnancies needs to have screening.
Does it cause jaundice?
Not directly.
Okay.
So possible, but not directly.
Okay.
So essentially, it causes a lot of pregnancy wastage. So miscarriages, recurrent miscarriages is one of the diabetes, one of the causes. Congenital malformations is one of the causes.
Okay,
so meaning that the child is born malformed.
Yeah.
One of the causes. So by the time the child is getting malformed, the body tries to take it out. So the child is not even born at all. But in some cases, the child is born. So those are some things we look out for. Sometimes the woman starts to add a lot of weight. And so we screen for some of them. And then by the time you have that, it now puts you at a greater risk for developing diabetes later on in life. And so it's important to check it. So we have these genetic factors that are there, but they don't all happen. So people that have all the genetic factors may not necessarily develop diabetes if they make sure that their environment is right, their eating is right, their activity levels is right, they are doing, and most of the studies, even studies done here in Nigeria, have shown that one of the most prevalent or the most important risk modification activities is exercise. So if we can do up to 150 minutes of exercise per week, that is 30 minutes per day, about up to 5 days a week, you can delay, if not completely remove the risk of diabetes that may have already been on the way to you from your family.
Wow. So I know some pregnant women may be listening. So what would you say to a woman who is pregnant, the gestational diabetes, is that what you call it?
Yes.
So they should watch their eating?
So
does that help?
Essentially, if you're pregnant in Nigeria and you're watching this on the internet, so chances are you have access to a good hospital as well.
Yeah.
So you should get registered for antenatal. Virtually all antenatal programs tend to screen for diabetes based on all the guidelines, local and international. They tend to screen based on certain parameters. Number one, if weight is greater than 90 kg, they normally will screen for diabetes. If there's sugar in the urine, so they do a dipstick, they tend to screen for diabetes. If there's any previous history of miscarriages or big babies, they tend to screen for diabetes. If there was any previous gestational diabetes, they tend to screen for diabetes. And some people just screen for diabetes from everybody, okay? But of course, cost is also a thing. So essentially, we try and do that. Now, if the sugar is high in pregnancy, the management is a little bit different, and that involves specialist care. So I'll advise you to get specialist care. It's not something that we can talk about over this.
Okay. Is it also predominant amongst particular races? As in from studies and because from the little I think, and it's like it's less predominant amongst Europeans compared to Africans, African Americans, Hispanics, and all of that.
Unfortunately, This is a recurrent thing throughout medical school and postgraduate training.
Yeah.
Almost every disease is predominant in blacks. I'm so sorry.
Like, okay.
Almost everything.
Wow.
And, you know, Africa and Nigeria, or sub-Saharan Africa, is now meeting what we call the double burden.
The double
burden. Meaning that in epidemiological transitions, in the way we see disease happen over generations, things happen in stages. Populations move from one disease level to another. And so the first transition is thought to be the transition of pestilence and famine. In those days, a lot of famine and pestilence. Africa is somehow still there. Then you move into one that has a predominant of infectious diseases, malaria, TB, HIV. Africa is still there. Tuberculosis and things like that. Most of the developed world has moved into the third stage and fourth stage, which now involves lifestyle diseases, diabetes, hypertension, heart attack, cancer. They have moved in. But while Sub-Saharan Africa has already moved into that new group, we are still battling with malaria, TB, and everything. So we have the double burden of the disease, unfortunately. So even among Africans, most studies show that we have it at an earlier age, have worse complications. But that also has to do with other things related to healthcare delivery. Our health-seeking behavior is also very poor. We don't tend to go to the hospital on time. We tend to believe in so many things. I've seen people do everything. Drink their urine in the morning, grind the grass, bitter leaf, bitters, alcohol, something, bath with whatever, no, just grind pepper and something, everything. So we tend to do all of that is until they literally cannot breathe or are unconscious before they get to the hospital. So those kind of things tend to perpetuate it.
So there's ignorance is also part of maybe it's a bigger disease really.
I think so. And of course, ignorance also has to do with also eating. So once you get some money, you tend to eat, you know. I've had a couple, you know, and I was talking about it to our colleagues in the hospital. 2 of them developed diabetes at the same time, and I was like, they're unrelated. How does this happen? So I got asking, and they said, well, actually what happened is that
they ran into wealth.
They were not wealthy, they were civil servants.
Okay.
But at the time when Abuja was new, under the federal government, they lived in a 5-star hotel under the federal government for 1.5 years because there was no accommodation. And at the end of that, both of them developed diabetes.
Wow.
The man said, you know what, I just came from the village. There was all kinds of food.
Wow.
And they ate.
And ate.
So that typically happens. Somebody has told me, Doc, when I did not have money, I couldn't eat. Now I have money, you say I can't eat.
Yeah, you must be kidding.
Give me the drug. I am going to eat.
Which is the challenge for a number of people. I remember going to one man's house, at least he's literate, but he said that, so he was opening bottles of non-alcoholic wine for us, which is also really high in sugar and all of that. And he said, he's a very big person. He said, I look forward to being able to drink all of these things. And now that I have the money to to afford it, they tell me I can't drink.
Yeah. So it's
almost unfair,
it's almost unfair. But so what happens now? People just have it, they eat anyhow, they do. So they also extend and they don't balance.
You know, I was talking with somebody recently. This is a bit of a digression, but then it's still related. You know, just what I said now about you are growing through life and you are really desiring someday I'll be able to afford this, I'll be able to eat that, I'll be able to eat this. And then you get to that age, you have all the money and they are saying you can't eat all of it. And I began to think that perhaps it also is telling us that the purpose of wealth is not for you to eat. It's actually when you get to that point, you should begin to think of give out. It's not the time to now begin to indulge. So it just means that if you are taking in more than you should have, it will hurt you. And that was just what solved that riddle for me. That why is it that I worked all my life to be here and I'm now here? You say I can't. Yeah, it's because really when we look at life, we all can subsist on little things. Exactly. Let the rest just go to be up.
You could not be more right.
Thank you, doctor. Okay, is diabetes treatable, as in, is it an incurable disease?
Okay, so the way I would say it is that diabetes is treatable.
Okay.
So let's look at diabetes as big nose.
As
a big nose.
Big nose.
Yes.
Like mine.
You don't say I've got cured for a big nose, do you? You don't say that. Because in itself, it's not so-called a disease, quote unquote. But then, that big nose puts you at risk of flies entering, right? So, the problem now is those things that diabetes causes, right? So, what you are doing by treating diabetes is, speaking, with an example, is like putting a net across that big nose to prevent flies from entering. So every time we are treating diabetes, we are not really trying to just treat the sugar. We are treating all the things that would have come. So we, in essence, we are curing by preventing stroke, hypertension, we are preventing heart attack, kidney failure. That's essentially what we are curing by prevention. And we are consistently going to treat. People say, doc, can't I stop everything? And what I answer is them, can you stop eating? So every time you eat, your body needs a way to convert that, and so you have to take something else to help it convert it. And so really, it is really, really treatable for the most part. People live long, healthy lives. So far, they're able to follow medical advice, and take the correct things, do the necessary things, and it can be really dramatic about how much recovery can happen.
Usually say prevention is better than cure. And it's also cheaper. Not
always cheaper.
Not always cheaper. Okay, so so you've corrected me. They're not always cheaper. And I know there's a branch of medicine, I'm a layman, called preventive medicine.
Yes.
Yeah, so, and I know that in our discussion today, you've mentioned that some. What aggressive methods or what aggressive steps can people take to prevent diabetes if they are not there, or to prevent it from exacerbating, from getting out of hand?
So, like I said, diabetes is essentially a lifestyle disease that affects food and energy. So one of the key things is exercise. Our aim for exercise is not that you become a marathon runner. No. Aim for exercise is for one to reach 150 minutes of exercise per week, at least. So we try and reach 30 minutes per day, 5 days a week. That typically gives dramatic results. It helps blood pressure, it helps blood sugar, it helps complications, it helps circulation, it helps food digestion, it helps bowel movements. I mean, scripture says in Him we move, kind of just get moving. So it does a lot. That's our aim. However, if you've not been exercising, I will not advise you to just go to 30 minutes.
Can I just interrupt? I remember some time ago, because I'd actually also gone to doctor for this. And you told me, because that really helped me when you told me, 2 things you did that day that I'll never forget. You connected something to my heart. I don't know what it was. And I was on a treadmill. Okay. And as I was on the treadmill walking, I could see my heart rate or something. They brought blood pressure actually dropping. The pressure, whatever, the blood pressure was dropping. And that for me just showed me the power of exercise. That was one. The second thing you also told me, if I'm getting my facts correct, is you said that in exercising, your muscles need sugar, so it also sucks.
Exactly.
And those 2 things, so maybe you should explain better.
So essentially,
because those helped me to, even though I've relaxed some, I need to get back.
So essentially, during exercise, initially, there is a blood pressure rise.
Okay.
So the blood pressure first rises.
Okay.
But when it comes down, it tends to come down a little bit below the starting point.
Okay.
So once you do that consistently, blood pressure can reduce consistently by 8/5 millimeters of mercury. So if your blood pressure was already 148 and you did exercise, it could come down to 140.
Wow.
So it can reduce the number of drugs that are needed, reduce the complications. The people that have diabetes, we are also very skeptical about blood pressure. We don't need blood pressure, what we consider not high for other people. For people with diabetes, we consider it high because remember they work synergistically together. So it's quite important. The exercise does quite a number of things. It gets the heart pumping. It allows the heart to have a lower resting rate, and it reduces insulin resistance. Remember, I told you that even when the insulin is not much in the body is actively resisting it. By doing exercise, you burn up adipose cells, and you increase the sensitivity of cells to insulin.
Wow.
And so that helps to take the sugar in. And also the muscles use up those sugar. So it's quite important. The caveat I will give, however, is that if you're doing exercise and you're having chest pain, you need to stop and get to a doctor.
Okay.
If you want to start an exercise program and you've never done it before, it may be a good idea to have a basic checkup before you start, so that you don't unnecessarily stretch yourself. And then after that, if you want to start, don't start with 30 minutes, because you probably will do the first 2 days and cost me out afterwards. So the recommendation is that you start with 10 minutes a day. Just simple aerobic, either skipping, walking, dancing, swimming, just 10 minutes a day. And you increase by 5 minutes every 2 weeks until you get to
the 30 minutes mark.
If you start having so much body pain, you probably are doing too much. So we just take a walk, 10 minutes, or what I can say
brisk walking.
Yeah. What I can say sometimes is park far from your office. Take that walk. Don't park at the door of your office. Take the walk and you have to walk back. That can take 5 minutes, and gradually increase that. Those simple steps can make a whole lot of difference in your health.
Can I ask you this? Because like I said now, and I'm encouraging our viewers to do that. Remember, you can ask your questions and subscribe. Click that button and subscribe. I said earlier that I'd like to gather my children and the family, everybody in my house to watch this. Now, sometimes it's difficult to get children to get into this regimen. What would you say about that? Is it important for parents to begin to say, my child, don't eat sugar, don't put sugar there, stay away from Coke, cake, no, let's go for a walk. Say something about that. At what age is it good to let them begin to get used to that? Because I think like that sometimes.
So my recommendation essentially is that for children, you may not necessarily need to restrict sugar. Remember that diabetes, I told you, is not a sugar disease. Okay. Unlike we're told, you're eating too much sugar, that's why you have diabetes. No. It may be, but no, that is not essentially what diabetes is about. Diabetes is an inability of the body to handle the sugar that you're eating. So if somebody is fine and they are a young age and running off and doing their normal, they're always busy, not busy for all the games, but they are busy also. Essentially, healthy normal level of sugar is not bad too much to an extent. Of course, excessive is now bad. So, but if you are getting a little bit older, you need to know that you need to start bringing those things down, especially as your activity levels decline, as you begin to grow older, cholesterol tends to get higher, your metabolism tends to change, then you start bringing it down and start curtailing it. And that really has a very big role to play in everything. All over the world, standing offices are becoming a thing, walking a lot, treadmills in the office space, and things like that. And all that is in a bid to reduce, this
sedentary
life. And it has a dramatic impact on diabetes as well.
Okay. So what I'm hearing you say is that I should cut my children some slack, but then more importantly, to just let children, especially teenagers, know that this is the goal. If you can begin to cut down.
Exactly.
Now, to begin to reduce, if you took a bottle of Coke every day, can you begin to do it one every other day and begin to, so that you don't have to get to a point where you are forced to begin to drop it, just, normal lifestyle. Now, you said so when I talked about preventive medicine, that I started saying that prevention is better than cure and cheaper. I said, no, it can be more expensive. And it's been said, you said that diet is very important, in managing, controlling, treating whatever diabetes. And from what I've realized, it's like eating healthy is quite expensive.
It is.
So the average monthly salary for a Nigerian, I think, is 18,000. Has it moved to 30 something? I don't know if that has been implemented. So somebody earns 25,000 naira a month, 30,000 naira a month, and is supposed to eat healthy, blueberry, blackberry, strawberries, and all of. What alternatives are there? I know you're not a dietitian, but if you can throw a little light, just little things that people can cheat on, compromise on, take advantage of, if they can't go to ShopRite and go to the vegetable place and all of those things.
So what I would say is that for the Nigerian diet, Nigerian diet already is very high in carbohydrates. Eba, pounded yam, rice, yam. Almost everything is carbohydrates. So essentially cut down on carbohydrates. I think that's a very simple thing to do. you can put in more of beans, you know, plantain and stuff like that. Now, if you have swallow, let the soup not be the thing that touches the swallow. Let the soup be the main meal.
Soup.
Yes, than the swallow. So let the swallow, anytime you are taking it, should not cross your fist size.
So portion control.
Portion control. Just look at your fist. If you are taking any food, rice, swallow that is bigger than your fist, you're probably eating too much. So just let it be at your fist size. Let the soup be full of lots of vegetables and drink it, eat it.
I've also heard that it's better to eat, you know, more times, little portions more times than eat one big plate of pounded yam in the morning, another big plate. You want to make up. Can you shed light on that?
So there are several schools of thought, but both, essentially our goal is to limit calories to about 1,600 to 1,800 kilocalories per day. So if you're eating small multiple quantities and it still adds up to plenty calories,
so it's about the calories really.
Will still end up. So you should watch what you are eating, how much you are eating, the contents of what you are eating. A very simple rule is if you add vegetables and fruits to each of your meals, chances are you're going to eat less of it. So if you had almost half a plate of salad, some small rice, some fish or chicken, and some boiled plantain, chances are you're going to eat very small rice. And that will tend to fill you up faster. And that makes a lot of difference. Now, we tend to want to eat a big portion. What happens when you eat a big portion is that suddenly the body is inundated with a large amount of glucose. So that becomes a problem to solve. But also taking small amounts means that even everything gets absorbed. So it's also, so what the total calories, what the individual amounts, and then snack with vegetables. So garden egg is not so expensive. You can use that as a snack.
To fill up your...
To fill up. In between, cucumber, it's a vegetable, you can use that as a snack. So
those are affordable alternatives.
Those are affordable alternatives you can use as snacks in between meals. They get you filled up and they get you needing less and less of.
Thank you very much, Doctor. You've been a source of immense help today. It's been an amazing session listening to you. And I think I should get a medical certificate at this point. I should be a consultant on this topic.
By all means.
After this. So thank you very much for being a part of this. I'm sure you've heard something today, and I really desire that you will run with this. I'll ask Doctor right now, are there any closing comments or word of advice you would like to give to our viewers? You can look straight at them and tell them something.
Okay, thank you very much for joining us on Safe Space with Wale Afelumo. I think, number one, subscribe to the channel. But quite importantly, life has no substitutes. So if you're feeling something, chances are something is wrong. Your body has a way of telling you that something is wrong. Either having repeated infections, you're drinking too much water, you're feeling you're losing weight, you're feeling you're losing power, you're feeling you're losing energy, or things are just not working out as you feel. It's quite important that you have a checkup every so often. So get to your doctor, get to a nearby hospital or diagnostic center or lab, and just get a basic check. If there's anything wrong, get to a doctor, who can actually look at it. There is absolutely nothing wrong with finding out that something is wrong. Because why? You know what to pray about, you know what to do about it, and you can actually make a difference, not just for yourself, but for your family. Now, diabetes is a disease of energy and a disease of feeding, meaning that when you eat, all the food is not getting translated, and it goes around to cause a lot of havoc. So what essentially happens is that over time, the body tends to be bogged down with that excessive unstored energy, and it goes to block up the blood vessels, and it causes vascular problems. Worldwide, diabetes causes leading amount of amputations, kidney failure, heart attack, stroke. It is considered a heart attack equivalent. So if somebody is having a chest pain and has diabetes, our mind first goes to having a heart attack, because the risk of heart attack is almost 5 times that of a normal person. So it's quite important that you know this and that you take your health seriously. Now, some symptoms may come up or some symptoms may not come up, and that's why I emphasize having a check. Now, if sometimes you have symptoms of drinking water excessively or getting tested too quite often or losing weight, and you have a check, what you essentially need to do is get to a hospital. The doctor will run some more comprehensive tests to find out, A, what your blood sugar is at that time, B, whether you need drugs or whether you start lifestyle therapy, or C, the other thing that you need to take in terms of medications. Medications could be several forms. Some could be form of tablets, or some could be self-administered injections. The self-administered injections essentially are in form of a pen. So the insulin pen looks almost similar to this, and then you just put it on your thigh and you press it once. That could make a difference in long-term life. A lot of people are afraid of medications, but that should not be so. Medications are actually extracted from food. So imagine taking all the things that are concentrated and fabricating them into a tablet or something that can help you function properly. That will make you function better, work better, live longer, and live better. So you don't want to be in such a situation whereby you are living suboptimally just because of a phobia. Don't get caged in by that fear. You can live above diabetes. You can live to multiple generations. And if you think that there's any risk of that, go have yourself checked out. You'll do yourself a great amount of good.
Thank you very much, Doctor. Tell us a little about what you do, cardio care, what cardio care is about, and how can we get to you in person, on site, online, and all of that. Quickly tell.
Essentially, Cardio Care Hospital is a cardiovascular specialty hospital where we take care of cardiology, which is disease of the heart, cardiovascular disease, of which we talked about, diabetes, stroke, heart attacks, heart failures. What we do is essentially we manage some with lifestyle only, some with drugs, and some with procedures. We admit, we have an ICU and do think a lot of that. Cardio Care is in Abuja here in Nigeria, and we're able to offer this world-class care by having a quite new facility, ultra-modern facility. It's quite comparable to anywhere in the world. Fantastic. And we are quite grateful to have that. But personally, I'm a cardiologist, and I see patients every day in the Cardio Care Hospital, together with lots of fantastic other consultants who are ready every day to see.
On what social media platforms are you?
So Cardio Care is on all the social media platforms, on
fantastic.
Facebook,
so
on
what
Instagram.
we're going to do, we'll ensure that is rolling, scrolling at the bottom of the screen, basically. So we'll get doctor's details to you, the address to the Limi Hospital Cardio Care Center, and doctor's personal social media handles. Thank you very much, Doctor.
Thank you very much, sir.
It's COVID season. I feel like shaking your hand, but I can't. Thank you very much, everybody, for being a part of today. It's been an amazing 60 minutes. I'm telling you, it's been an amazing 60 minutes. And you know, there's somebody that needs it that may not have seen this. So go to the share button or click the link, copy the link, and broadcast it on your WhatsApp or social media platforms and let people get this information. It may be the difference between life and death for somebody. So please do that. Remember to subscribe to the channel. Thank you for being a part of this. Like, come again in 2 weeks' time. This is Pastor Wale Afelumo on Safe Space. Thank you very much. God bless you. You matter to God. Bye.
Bye.
Thank you very much, Doctor.
Thank you, sir.
God bless you.